10 months down the COVID-19 pandemic, and the world already has 10 different vaccine candidates in different stages of clinical trial and also in phase 3 clinical trials that perhaps holds a hope for us to get out of this pandemic. But in the case of India, we also have almost 4 different candidates that are in phase 2 and phase 3 clinical trials. These are early days. We still have several trial loops to jump in. Yet, it's time to start preparing on how India will vaccinate a billion people. So the first question in everybody's minds is that when will India actually get a COVID-19 vaccine? We know that there are 3 different companies that are in phase 2, phase 3 clinical trial. We also know that the Russian vaccine, Sputnik 5, have also started the clinical trials. We have 4 different candidates, which is Serum Institute of India, Bharat Biotech, Zydus Cadila, and Dr. Reddy's in partnership with the Russian Development Investment Fund, who are developing the vaccine for COVID-19. All of them are in phase 2 clinical trial, and we're expecting that sometime early 2021, we will see the trial results coming out from these companies. Now, whenever the vaccine comes in, the second big question that we have to deal with is that who is going to get the vaccine first? The Health Ministry has reiterated several times the first priority will be for essential workers and healthcare workers. And those are the people who are going to get vaccinated first. Now, what we know right now is that whenever a vaccine will come for COVID-19, it will be rolled out in a phased manner. And that would include priority states or priority people and healthcare workers, healthcare staff, doctors, nurses, few bureaucrats, and few essential industry are the first people who will be getting the vaccines first.
It's completely possible that India will do what the rest of the countries are doing, which is, really prioritize their population as to priority 1, priority 2, priority 3, and so on, in terms of who gets the vaccine. So, for instance, first responders, healthcare workers, essential workers, and then nursing home. That's how it is being done in the US. And workers are priority 1. And then the elderly population in nursing homes, and so on. And then you have the priority 3, which is the general population.
Right.
So if you go by that token, then that percentage number that you talked about cannot be, percentage of the general population. So the question that has to be asked is, if you have defined your priorities, then in 2021, what percent of your top priority, let's say it's healthcare workers, right? What percentage of your healthcare workers are you going to vaccinate by 2021?
Right.
What percent, and then you come to priority 2, what percent of your priority 2, and then priority 3.
Now, we've been speaking to several experts and who have been giving their own timelines from the past experiences of vaccination in the country. And one of the biggest things that they talk about is that this is for the first time ever that India will be vaccinating 500 million people during a pandemic, when the pandemic is raging. This never has happened before. And most of the immunization program of India, we have the National Immunization Program. This is only for children and pregnant women. So this is also for the first time India will be vaccinating adult people. This is never done before. And this is going to bring in a new set of challenges and logistical issues that India has to deal with. So when will a common people get the vaccine for COVID-19? We all have to temper down our expectations. This is what the experts that we speak to tell us, is that perhaps the best case scenario that we can hope so is end of 2021, when you and me might get vaccinated.
I think a paper by 2021 is very unlikely for many reasons. So I'll start by saying that first and foremost, that these vaccines that are still in phase 3, let's not forget that these phase 3 trials, the Bharat phase 3 trial has actually literally just begun.
Correct.
And the Serum Institute, I think, is also in the very early stages. So, and these are 2-dose vaccines, and then if the government statistical guidelines follow the WHO guidelines, which is at least a 2-month follow-up, which means that the approval of these vaccines already gets into the first part of 2021, maybe to the mid of 2021. So that gives you a very little window. You only have 6 months left in 2021 to begin your implementation.
Who pays for the vaccine? What would it cost for the Indian government to vaccinate at least 20% of its population? The numbers vary from 40,000 crore to 80,000 crore. These are all estimates at this point of time. We still don't have an official number from the government side on what exactly is going to be the cost for vaccinating such a large number of people. But what we know is that the government has funds available to do a mass scale vaccination. There are financing available from World Bank that has offered $1 billion to lower and middle income countries for vaccination, or specifically for vaccination. This is something that Indian government can go and seek out. There are other options such as the COVAX facility of WHO and the Alliance, who are also providing vaccine at a subsidized rate. The Serum Institute and AstraZeneca pricing for vaccine is $3 per shot. This is the price that we have right now. And if let's assume that it's a double shot, we are looking at a $6. Now, if the Indian government wants to buy vaccines in a large scale, it can through tendering process bring it down to $1. We don't know if the vaccines is something that we have to pay for or it's going to be free. The child vaccination program that the Indian government runs is completely free of cost. The central government bears the cost and pays for these vaccines. Now, we don't know if that's what is going to be for COVID vaccine also, because as I said before, that this is for the first time that India will be vaccinating adult population from a very much a public health perspective. We are all very euphoric that we have several candidates that is under work. But there are certain vaccines that require very specific storage and cold storage required. For example, the DNA vaccines and the mRNA vaccines that are being talked about, which is a new vaccine technology. These vaccines require a cold storage of almost minus 80 degrees compared to other vaccines, the traditional vaccines like the inactivated vaccines, which we're seeing from companies such as Bharat Biotech. These require, the temperature requirements for these old vaccines is much easier to manage than the new cutting edge vaccines. This is something that we need to prepare for because we've never used the new kind of vaccine in our vaccination program. So how are we going to deal with it? That remains one big concern. Is this something that the government of India is thinking? State governments, do they have a plan in place to actually roll out new vaccines whenever they come in? These are the questions that we have to keep in mind. We need to keep in mind is that India runs one of the largest immunization programs in the world. The Universal Immunization Program of India, which started off in 1985 for children and pregnant women, is one of the largest in the world. Now, what we need to keep in mind is that, and this is something that the government of India has to think about, is that are we going to use the existing vaccine infrastructure or are we going to create a new one altogether? Because let's keep in mind that we don't want to disturb the existing infrastructure that is a well-oiled machinery for the child and maternal vaccination. This is something that's something which India has done great work on, and we don't want to disturb that. So, which means that we need to have a separate training for people who are involved in COVID-19 vaccination, so that we don't disturb the existing vaccination network that is already going on. So, these things is something that the government has to perhaps go back to its drawing board, look at the experiences from other vaccination programs and the recent vaccination program and see how they can roll out. So to sum up this entire discussion, 10 months down the line, we have 10 vaccine candidates that are in phase 3 trials. This is a big feat. We also have to keep in mind that we need to kind of temper our expectations that vaccine development, the success rates are 50-50. So those are the expectations that we have to keep in mind. Yet, taking all these things into account, we need to, as a country, be prepared that whenever a successful vaccine candidate hits the market, the infrastructure has to be in place. The human resource training should be in place. The distribution channels should be in place. The state should be prepared to train their own people in terms of how to actually vaccinate the population. And we also, as people, have to be prepared that we might not get the vaccine as soon as we are expecting that it might come in. This is Divya Rajagopal for ET, and we will be bringing you updates on how the vaccine rollout of India takes place. Thanks for watching.